but I think we should allow a little bit of time. On my computer, it's showing 44 participants at present, and it's slowly increasing. I had a note from Dr. Porn from our Singapore admin headquarters to say that yesterday they recorded 99 participants from 21 countries. So that shows sustained, strong interest with regular returnees day on day. There's a committed audience here that is finding the contents of Dr. Pradeep's presentations of great interest and value, and they keep coming back for more. So that's very encouraging. So we have another session ahead of us. Let me also take time to say again, thank you to our backroom team, Dr. Porn in Singapore, Dr. Popo Ong here in the Bangkok office, Mrs. Wulandari, who are helping to keep the technical aspects coordinated so that the course flows well. So to those three people, I think from all of us, a sincere thank you. And then, of course, Dr. Pradeep, whom I'll thank again a bit later on. But you've been doing a wonderful, wonderful job, Dr. Pradeep. We're all very grateful for you providing such a very high level, top quality presentation course. And we're all benefiting from that. So I see we're now on 48. Let's give it one more minute. I should also mention that our backroom team, technical team, they'll be going through the participants that attended each day. Unfortunately, to be fair, we can only issue certificates of attendance. You get a certificate to confirm that you participated in the full course. But to be fair to everyone, we'll only issue those to people that attended all 4 days. To some of you who may not have been able to participate for various other conflicts of interest, I'm very sorry. But again, to be fair, we can't issue certificates for partial attendance. But I'm sure that everyone, however much time you're able to devote to participation, we all benefited from that exposure to the presentations. Dr. Pradeep, we're now on 54 participants. It's 3 minutes past the hour. I'm always reluctant to inconvenience the majority who have made effort to be on time for the benefit of latecomers. One tries to strike a compromise, but I'm going to suggest that maybe we should start. Are you okay with that, Dr. Pradeep?
Yes, yes, yes.
Excellent. Yes. So let's move ahead. Thank you, Dr. Pradeep. We look forward to your presentation.
So nice. Thank you. Always very, very nice and kind-hearted words like an elderly and governed person. Let me share my screen. Today is the okay. Is it okay?
Very good, Dr. Pradeep. Excellent. Full screen, all good.
Okay, so that's fine. And the audio is also okay?
Perfect, Pradeep.
Thank you, thank you. So today is the last day and we will be having a little bit recap of the previous session so that because this is the very, very important understanding everything, learning everything is very, very easy or sometimes by virtue of repeated exposure it comes. But when it comes on the documentation side, it is little cumbersome process and a big challenge. So basically, when we start, I'm not going to divide the session as per the contents, but basic understanding is that what is the basis of the plan, situation analysis, need, whatever goals and targets we have fixed, what with the what objectives, what exact strategies we have been talking and we are going to put in the our strategic plan when we are trying to formulate a document. In that strategy, how it will be implemented, what are the different norms. I'll give one or two examples only, because if there are 60 70 activities, I cannot just in this short time we cannot give the norms, and the norms will be differing from different countries. Then what are the financial norms? I mean, we have to understand how the financial norms are to be fixed, or it is to be used in the planning the financial budget cost sheet. And then we have to understand, or if we do not have the total, then we have to divide and make it a unit cost, because most of the time the financial expert, they ask what is the unit cost. Then finally a big financial calculation sheet will come, and then it will be followed with the annexures, references, executive summary and all those things. So this will be the whole gamut of this today's presentation. So formulation of this. Now, before we go for formulation, though this picture looks for the integrated vector management, but we are discussing only for formulation of vector control plan. So the first important point which we have to learn is the situation analysis. This is very, very important, and this is a magical picture which will help in all other content. You go on changing the subject and it will give a formulation. So situation analysis, when we are talking of vector-borne disease and vector control plan, so we have to see the disease situation. As usual, first criteria will be the case, the disease burden, then who is the transmitting agent, vectors, which prevalence, all those points I have already discussed in that. Vector assessment itself, it's a big chapter, and it will include many activities, and all those activities one by one we have to fit in the Excel sheet. Then if we have done a stratification, then all those activities in different strata, what are the activities which are being planned? So different strata, so we have to divide into the different groups. That also we have discussed in the different groups with the priorities. So different strata, different groups, different priority, which activity are to be planned. Then what are the local determinants and what actions are required to assess those determinants and then to mitigate those determinants, or to adjust our program implementation with those local determinants. Like, for example, if people, they have the habit of mud plastering immediately after the spraying, so there will be some activity will be required to change the behavior of the people, to convince the people. So going to the people, reaching to the target audience, convincing them. For convincing them, in between we require some materials for our support. Who will go? They also need to be trained. So all those small micro activities has to be planned for each category headings in different Excel sheets. Maybe you can make a different sheet for different activities and then go on clubbing that. This is not a big job. Those who are all handling Microsoft computers, Word or Excel file, this is very easy thing. You don't require any financial expert for that. If you have a financial expert, you as an entomologist or as a vector control expert, or for total strategic planning, if you want, you have to explain everything to the financial expert, because they need to be oriented for the basis on the technical requirement. So technical justification has to come from our own mouth. This is very important point. Then whatever vector control tools we have selected, we have to fit in logistics, implementation, and in between whatever all the planning activities are required, because every activity has to be linked with the financial aspects. That is what is plan. So plan first part will be physical, how we are going in different strata, which activity, I'm coming to that. And then needs and resources, we have to work it out. What is our technical requirement for that particular population or that particular area or that particular foci, for one activity, two activity, and then accordingly we need in terms of the tools, in terms of the implementation activity, in terms of human resource, in terms of advocacy. Then while doing implementation, there may be some challenges. So always we have to keep a plan 2. That is the trick of the management, that always we should have an implementation strategy backed up with the buffer plan, which we call it as a management strategy, we call it as a plan B. So that should also be taken into account while formulating the plan. And then when we do the monitoring, there are two kinds of. One is monitoring, which goes along with the program implementation. That is also divided into two. One is supervision, consecutive and concurrent, and then monitoring. For example, if we do the, say, for example, LIN distribution, we have planned that for one particular zone or one particular area, the LLIN is to be distributed. Now we have to understand that if we have planned from May, whether we have submitted the indent in December, if it is done, whether the indent has been processed, whether the orders have been placed, when the store is likely to reach, whether the store persons has made all arrangement to keep the stock, otherwise it will be lying outside, whether the transportation cost, if at all it is an inbuilt, or we have to manage from main store to the district store or to the sub district store, whether those things are ready, whether we have already given the invited the tender or quotation and we have finalized the transporters who will be ready so that there is no delay. So all these micro things will require to be written in the plan, and then we have to write. For example, in IRS, if we are planning IRS, whether the supervision team has been properly trained, it has been oriented, it has been formed in the district level or at the PSC level, whether they are transport, otherwise you suddenly you cannot ask, you have not gone, you have not provided the facility, that was not inbuilt component, that was not made up in a plan document. So the administrators or the financial experts or the governing bodies, they will not give the money. You have to justify. So every activity micro level, it has to be given in detail, then only the plan is successful. Simultaneously, we have to understand that these things are not, it should not be very bulky so that people will not read. So it should be crisp. It should be very crisp. So basically these 5-6 points, if you start making it, then we will go. And then we have to divide the whole plan into different area, strategic area. Coming to the next slide. So this we have already understood that what are the key points, key challenges. That first thing is start with the background material of this, which vector-borne diseases, area, demarcate, different foci. Co-endemicity has never been taken into account for planning. Except very in rare cases, because everybody has been making their own plan. Malaria has been making a separate plan. Dengue and chikungunya has been making a separate plan. Visceral leishmaniasis and scrub typhus and lymphatic filariasis, they all have been making their separate plan, and nobody wants to intervene. But when you make a comprehensive plan, your malaria plan cannot be made in silos if there are overall vector-borne diseases, because at the end, what is suggestions given either from WHO or from the national authorities or from the regional groups or from the WHO country offices, at the end, the whole system has to be taken by general public health system or general health. So unless general health is taken right from the beginning into the account, it will be very difficult for them to absorb. They will say, this was your baby, you go on handling it, even after the achievement you have gained. So suddenly you cannot change up the points. So all these points, entomological data, what they previously available or not, you have to do something survey. Then stratification, whether it has been done, you want anybody's help of the computer experts so that you can go on giving the data and he will plot in the map. Or if something goes beyond mapping, what more data you require, what more layer you want to put it into GIS system, so that along with the epidemiological data, some vector control or entomological data, some intervention data, And then you can go on giving the meteorological data, rainfall, temperature, forest availability, water bodies, so many layers, 7, 8, 10 layers will come, receptivity, vulnerability, migration, cross-border. So all those things will come. So you may need somebody's help who is expert in GIS or computer expert, software developers. So those things has to be planned in this particular topic. Then tools used, whether they are available, which kind of tools you are using, or you have some kinds of special permission for some area you want to innovation, you use the innovative technology. Or so if you want to have some inputs from operational research and put it in innovation technology along with your conventional tools and technology, you have to divide and then you have to make your provision for that. To all those things, you have to have the vector control need assessment. Vector control need assessment is also being advocated from high burden states, high burden area. The vector control needs will be different for middle, because we have been listening for the last 3 days. So for middle level or the lower level, low endemicity or transmission intensity wise, there will be little bit more, less requirement will be there. So whether you will keep the provision little reducing, or you will keep the provision for something else so that it can be taken, or you will keep under some flexible pool funding, something like that. If something happens, you can immediately draw. So these three options will be available for making the plan documents for that. What is existing policy? Do you need any amendment on that? There are different policy which I told. There are regulatory policy, there are insecticide use policy, there are production policy, there are irrigation policy, there are education policy, there are agriculture policy, there are environment policy, there are many regulatory policy for building constructions and mosquitogenic conditions. There used to be earlier, I remember long back in 50s, there used to be anti-mosquito major scheme, which was governed by the building laws and the town planners. They used to have. There used to be the public health engineers earlier, so they used to act according to the law of the what you call it as the building bylaws, or the so no building or no town should be. I mean, everywhere there should be proper gradient maintained. The irrigation channels, when they have to make the gradient. If the dams are being constructed, there should not be any seepage, so that the nearby residing at the ground level, the people, the villages in the catchment area, they should not be affected with the breeding of the mosquitoes. So all those things has to be understood when you do the vector control need assessment, and then all those points are to be taken. Some points may require only at the meeting level, but some financial, when you have to write something, so that will also be one agenda when you discuss some higher level meeting and advocacy planning. Advocacy plan is a very important topic. Sometimes advocacy plan is merged with the all other diseases, health problems or national health programs. Sometimes advocacy plan or the IC activities or the BCC activities are pulled together just to facilitate that what is the total kitty for this particular activity. But health, there are different subjects, they require different specific advocacy plan. The family planning, RCH, tuberculosis, malaria, leprosy, all advocacy cannot be in one go. If you start, why we have broken all these lectures in 4 sessions, because in one day I could have finished all these things very hurriedly, but then it will go over the head, it will not be absorbed. So there is always a human absorbing capacity. Similarly, if you club all those advocacy plans or BCC for all those diseases and go to one village just to save some cost, so one person will tell one line for malaria, one line for leprosy, one line for TB, one line. The villagers will, I mean, it will all be futile exercises. Yes, sometimes in general, there should be some health mela, some focus. So there should be different stalls. So there some integration is okay. But then there are specific timings for malaria transmission, peak transmission, LF transmission, dengue transmission, control measures, collaborative. So all those specific plan has to be made so that the community and is engaged properly and advocated properly. Not only your community, the service provider group and the recipient group. The service provider group is the people who are going from the health services or from different partners, intersectoral partners. They are going and providing their services to their respective jurisdiction. The recipient group is who is receiving all these our services, whether it is they themselves they are doing, NGOs are doing, or government is doing. So they must be taken into board. So what is the plan? Then there is a vulnerable community plan. This is a very important point which I did not discuss earlier. So what we have been talking about the vulnerability. Vulnerable community can be identified that in your area, which is the vulnerable community. That is the migrant, pregnant females, or it is a comorbid condition people. So who are all vulnerable for such diseases? So those people, how they will be educated, how they will be taken to the for the clinics, how they will be prevented from the mosquito bite, because if they cannot do, something has to be provided. So all those plan has to be ready. Having understood this chart I showed it, but you saw now it is clearly grouped into 6 groups. When you are making a vector control plan, we will exclude all other plans, because otherwise the total strategic plan becomes a little bigger. So if we talk of vector control plan, we have to see all these things which we have been talking. One is source reduction, you start, then anti-larval works, where, when, how, who. Then same is the case with the anti-agent measures. If you are doing fogging, it's all right. If you are not doing fogging, that is all right. It all depends on the government decisions, respective countries' decisions, and the tools which they have been using, the implementation strategy they have been using. If any of the strategy in silos also they are implemented perfectly, definitely some dividends will come. But if you in high morbidity condition, as technically we have learned that we must do all weapons we should use, so that it is clearly attacked. We are doing LLIN, we are doing indoor residual spray, we are doing fogging, we are doing anti-larval measures, we are doing source reduction. Whatever is feasible, you integrate 1, 2, 3, 4 or all. You have to ensure that by the end of 27, you are completely free from malaria. And to do all these 3 activities, 1, 2, and 3, you have to have the skilled laborers, skilled personals in the field. So capacity building, which will be right from the central level to the state level, to the district level, to the ground level, at the sub-district level, block level, village level. People should be there to do the advocacy. Whether you involve ad hoc, you involve regular, you give somebody other responsibility, or you involve in general a department of health education. There are some different names for department of health education. And for the higher level people who need to be educated, need to be brought on our platform, so that advocacy has to be communicated in a very well designed language, designed pamphlet, designed posters, designed presentations specific to that particular organization. For that, every plan has to be formulated so that it can be budgeted properly. This is the chart which will involve all other stakeholders. This is a little looks very complicated. I did not show it earlier because I kept it reserved for the last day presentation. If you want to see the real impact for your plan, in your plan, all these things, vector control activities, and we are talking only for the vector control activity. So I have deleted all other things. Vector control activity at the governance level, at the state level, at the block level, who will give the guidance to different level, who will do the advisories, who will involve corporation, what will be their responsibility, what will be responsibility of community leaders orientation. So all these one line which is showing as a bridge, it needs an activity, and this activity needs to be written in 2 or 3 lines. That who will do, how he will do, how he will be supported, when he should do or she should do. So the activity has to be done by whom, when, how, and why justification, and then how these stakeholders will be involved: railways, health, agriculture, environment, water, sanitation. This different places, different countries. because Leo was telling that 22 countries they have joined, and there may be little more. So different countries, they have got different stakeholders. In addition, there will be WHO, there will be multinational partners. There are many organizations, Global Fund, World Bank, PATH, APLAMA, APMAN, different countries, they have got different NGOs, different. So all those people, they need to be brought on one platform, and it should be 1-2 lines should be written that these are the responsibility. For these, we expect them to do this, and they should be, if they accept, they agree, then there should be accountability and responsibility should be shared with them. This is very important before we go for this. There has been one unique problem last 2 years we have been facing. In addition to our comorbid conditions under within the vector-borne diseases, whether it is a scrub typhus, whether it is it's a malaria with dengue, malaria with scrub typhus area, or area is endemic for different diseases, lymphatic filariasis, Japanese encephalitis. There has been this special problem that sanitization work started on a war footing during the COVID pandemic. Now, how this plan will be, because we are still not completely out of this situation. The cases are reducing, then suddenly somewhere increasing, then suddenly somewhere reducing. Sometimes mask is out, sometimes mask is again in, sometimes the washing is out, sometimes washing is in. These are all practice and habits. But if you look in closely, still there are something which we can plan and share with this situation. Anti-larval spray, they are doing sanitization. They are also using knapsack sprayer. They are also using knapsack sprayer. They are sometimes they have been using these fogging machines with this little bit adjustment of nozzle. They have been using sanitization on the roadside. We have seen it. Whether it is right or wrong, I am not commenting on that. This is not, today's session is not for that. Today's session is what activity, what tools are under the things. And I understand that many of the tools which were used in the malaria program or the VBD program were utilized during this period for such purposes. So we should have a plan, buffer plan, that if they can use our tools and we can also take, in case of shortage, we should have a list, we should update, we should have a close collaboration with the people who have been integrating that how much tools they are having. I remember one of the place when chikungunya outbreak came, we were just touring in different states, and one of the state we met district collector, which is the district administrator for the whole district. And when we were discussing, madam, this is the situation, she said, doctor, please come in the evening 4 o'clock. I will call all the people's meeting. Because once district administrator, they ask, everybody has to come. So this was a very good example of involvement. And she was a young lady, direct recruited, very powerful district collector. She invited all those people, and district VBD officer, district malaria officer, we used to call it. He was just saying that, sir, madam, we don't have pumps for doing the spraying and contain these outbreaks. What to do? How much you want? She was knowing that very recently, last week, there has been many pumps purchased for agriculture purposes. Now see the mindset. Mindset was that she asked me, doctor, as a technical expert, you say, can the agricultural pumps of 12 liters be used for malaria spraying? I said, yes, technically, yes. Why not technically? Why we have given 10 liters pump or 8 liters pump? Because they cannot load it on, it will become little heavy. And agriculture people, when they go in the field, they just keep and then go on, because they have got little big lancet and other things. Technically, yes. The only thing that the people working, implementing, they must know how to make the dilution, what should be the discharge rate and all the things, and how much minimum quantity must be there to create that pressure. So the problem was solved. So this is the way, that's why I wanted to show this particular designed graph, that there are some synchronization between other programs, especially in outbreak situation and such situation which pandemic we have been meeting. So we can always put one para on such situations dealing when there is a synchronization. So we can always synchronize, we can offer our support, we can take support from them. This is very important. Now this graph I did not discuss much on the second day. entomological survey, vector surveillance plan. This is very, very important for our budget preparation. If you want to have, this is the scenario which we long back in Indian scenario, we gave the direction, because when in 1977, when we had grouped 380 plus districts were there during that time. So some zones were created with purely with the entomological officers. Then and the full team was entomology was asked, advised that, okay, if you are having one district, two district, three district, four districts, the number of districts within the jurisdiction of entomological zone. Nowadays, what we are talking of, sentinel site should be representative of that particular geographical area. So we divided a clubbing of 4 to 5 districts and formed a zone. Why I am showing this graph? Because this table will be very much helpful in making a plan when you are converting into the financial plan. Because take one example, if one zone with 2 districts, he or she has to cover, this zone has to cover 2 districts, how he will plan his visit? Regular is it on all the months? So in all the months, the team has to go, that what is the distance, what will be the mobility cost, what will be the per diem cost, travel cost of the individuals, diesel cost or petrol cost, or if they are taking nowadays, the tradition has come that you don't get a proper vehicle by the government setup. So those vehicles, so you have got a on the rent. So which kind of vehicle and what is the rate, 10 kilometer per kilometer, or $1 or $2 or $3 or for $4 per day, for how many kilometers? So you have to understand. So accordingly, you can make this plan. So this will involve, if you are having 3 districts, then you can plan for all the months or alternate months, or if you have first, second districts, you can go in January, March, February, then one alternate month, January, then another district in March, then another district. So something like that. They alternate, leave one district for another 1 month for other district, and then come back to other. If you have 3 or 4 districts, then you can make quarterly. If you have more than that, you can make quarterly, or you can fix one as in a high endemic district and 2 in low endemic district. So something like that. I just try to give an example. If you are having, purpose is that technically we have been discussing that sentinel sites should be sentinel sites means sentinel area. One very important point just came to my mind. I just want to explain that for all my friends. Sentinel site does not mean that catching station. Sentinel sites is that area. In that you have to fix, I mean, we have been advising that we have to fix 4 fixed sites, 4 random sites, and four human dwellings, 4 cattle sheds, and 2 mixed dwellings. So altogether it becomes 10 catching stations. And each catching station, if you are going 2 persons, I mean, we have been designing that you spend 7.5 minutes, so 15 minutes. So 2 persons means if they cover for 2 hours in that alternately. So if 10 sites in 15 minutes, it becomes 150 minutes for 1 person. So if there are 2 persons, there are 4 persons. So the whole collection time becomes like that. These are all the micro planning, which will be very, very important. And there are big sessions for that. We have been advising them. This was just a graph that when you are going for entomological monitoring, vector surveillance, this particular table will definitely be very much help, so that you can plan depending on your distance from your place of posting to that particular area, returning, or you want to stay in that area, and then how much, I mean, what will be the total contingent cost, regular contingency you require. You require many things in that torch cell. So many contingent items you require for that. There is another point of making the plan, that if you are making a committee for adjustment, then what should be the composition of the committee? And if you are calling all these people, so what is the frequency of meeting your technical committee? Now, if you are making the meeting, the technical committee means it should be headed by a technical person. Another administrative committee means, elimination committee means it can be headed by the administrative people, policy makers. So this is a technical committee. There should be Director of Health Services or Director General of Health Services, whatever is in your country. Then malaria department, definitely two people are very, very core. That one is the malaria director and one is the vector control experts or the head of the entomology or vector control divisions. So these two people are very, very important. Then there are different representatives from WHO, country office, or any coordinator if they are posted. Then Department of Health Research if you have, or operational research, or any academic institutions who is helping the program. Then you also have different representative from different department, environment, health promotion, or education, or urban development, agriculture. When you make this committee, this also should be a part of the plan, how frequently they should meet. And when you call a meeting, what will be the tentative expenditure for that? This, what will be the agenda? You have to circulate, then call them, and expenditure related with this meeting organization. This list can be expanded depending on the different country situation. So this slide is little messy. I'll show in that. Yes. Now take the example of the component. I'll discuss two components mainly, and similarly other components can be added while making the formulations. If you are taking LLIN, which is a core strategy for vector control, say take for example LLI. The decision, universal decision taken in 15, 16, 17 that API less than 1 should have LLIN universal coverage. Now, how it should be factored? What should be the plan? Is still some of the areas in African regions they do have, so they want for universal LLIN coverage. Now, what we have taken that 1.8 is the official figure. Earlier it was 2.1 or 2.2. Now it is 1.8. Means one LLIN when you are planning for procurement, you can take 1.1 mil, one bed net for 1.8 mil population. So what does it mean? And then you can fragment that if you have limited resources, if you have full resources, absolutely fine, simple calculation. But if you have limited resources and you are going in a phased manner, because it all depends on the suppliers, manufacturing capacity, manufacturing units, and your budget, everything. So, and the donors funding. So go from the top. I've just given one example that API more than 5. All this is an assumption. Because assumption is very, very important in our planning. So if you are making the assumption, so district with API above 5, we assume that all the subcenters will be more than 1 API. Districts above 2 to 5, between 2 to 5 API ranging, we assume that basically some of the say 50% of the subcenters will be definitely more than 1 API. Another assumption may be wrong, assumption may be very, very tentative. Districts between 1 to 2 API, they will have further reduction of the subcenters, because some subcenters will have more than 1 and subcenters will not have. So maybe take a 25%. It's just a systematic calculation for remembrance. And then districts with API below 1, they will have say about 1% or 10% or 5% of subcenters. So just take, because most of the cases, there is no case. Initial starting point, if you have limited number of bed nets, we can have thinking on that this is one way of making a plan document. Now, what will happen? While distribution plan or calculation plan of this, so take the population of this, take the population of these subcenters, this area, divide by 1.8. Take the population of this area, divided by 1 by. Take the population of this and then divide by 1.8. Take the population of this and divide by 1 and then total it. So you will come to a consensus conclusion that, okay, this is one basis and we have come that our total requirement becomes this for LLI. But if you have been doing earlier, so you have to take the replacement, replenishment or replacement policy also, that if they are 3 years completing and still there are cases, you want to sustain the gains. So definitely the red color will help you, that this is another basis, that why do you want to replace again and keep it for 3 years. So over and above this criteria with the initial, if you have distributed here, continue for next 3, distributed here, continue for next 3, distributed here. And in addition to all these 2 concepts, you keep something for the outbreak situation. So usually we keep for 10 or 20% depending on the your terms and contract of the donor agency or the requirement or the area. If you have given 100 bed nets for some area, if you keep 10 bed nets, it hardly matters, because logistics also 10 to 20% buffering is allowed. How you distribute when you come to the real distribution at the LLI? We in our country, we have got 3 kinds of bed, 3 sizes. One is a small size, single size, that is 3 by 6, usual one single bed net. Another size is queen size bed net, that is roughly 5 by 6 or 4 by 6. And then king size bed net, usually 6 by 6 or 6. Usually it is 6 by 6. So you divide some percentage, and this is purely based on the population gamut. So if you divide the total population from 1 to 10 years or 15 years population, plus 15 to 25, 20, 30, 35, 45 years, and then above 45 years, because they may have another children and they may not like to sleep separately. So you divide the total population into 3 categories, and this is roughly calculation 7.7 or 8%, 78% or 14%. So 100% we can divide like this. Even then, after this criteria, you can also fix your own criteria depending on your population size and population gain. This will be very easy for distribution at the village level. Or at the so if the population of 1,000 persons, how much bed nets of this size, how much bed net of this size, how much bed net of this size would be required to be given to that particular representative who is coming from that particular village. If I am a village volunteer and I have to cater the services for say 2,000 population, I have come to the yesterday's somebody was asking the campaign mode and other things. If I have gone, I have given my requisition slip that, sir, I have, see, this is my area of jurisdiction. I have got 2,000 population to give. 2,000 population, how much bed net of single size, double size, and large size, how much I require? Take it, sign it, go. So this is the way the planning should go on. It may be 8%, it may be 9%, it may be 10%, it may be 60%, 70%. So this is one example I have just given, which we have experienced in the field. We have learned from the field. We also learned lot many things from the field. That is a real exposure. Take another example for indoor residual spray. Indoor residual spray, when we talk, most of the people, they are fully well versed with this indoor residual spray. But you know, indoor residual, which is also a core intervention. How to calculate the standard dose? That should be a part of the guidelines. Then why it is required for the planning? People will read that plan document and then say, okay, I have got this much area. And when we calculate at the larger level in metric ton population, metric ton per million population, it should be divided into different, what you call it as a level for a smaller population, maybe into kgs, maybe into grams, maybe into something, whatever unit you are following. So that people at lower level, they are not confused for conversion with the metric ton to the kg, into the grams. So this is very important for that. If you have this particular, if you want to have this particular dose, how much quantity will be required for this particular insecticide? I'll just show one example for that. I have just kept one slide for that. Then if you are using 2 rounds of synthetic pyrethroid, for regular rounds, what is the total quantity? So you must calculate for 1 year. minimum 1 year. So annual requirement must be calculated and it should be shown very clearly in your because the budget is also annually. So annual budget should match with your annual requirement. How it will be calculated? You are having some projected population. If your population is decreasing for IRS projection, your requirement will go on reducing. But once you reduce your requirement, maybe your unit cost will increase. Because when you purchase less quantity, the supplier is bound to raise some quantity. Those who are completely depend on the public health program, because they are producing for you. So if they are producing for you, so just keep in mind, this is justification for making the cost analysis. Once you make the physical plan for different 5 years, say from now everybody is in the stage of making a plan for 23, 24, 25, 26, 27. So if you are making the plan, if you are reducing, definitely you should have. And at the far end of the plan, you should have some quantity to meet any exigency yesterday, which we have been talking. Usually we keep 10 to 20%. In addition to the cost of the insecticide based on the dose calculation and population and the number of rounds for the area or for the population projected, you should have a spray wages cost. Spray wage cost also variable from the different places, different states, different countries, because the spray cost, the labor cost, labor wage is governed by the local labor laws. Somewhere it is centralized, somewhere it is a decentralized. So it is a state-owned department. So you must take that minimum wage for the skilled, minimum wage for the semi-skilled, minimum wage for the unskilled. So in your area, in your country, in your states, whether spray workers, they come under skilled or semi-skilled. They cannot be unskilled. Transportation cost. Here also transportation cost is very, very important. When the insecticide is reaching to the district headquarter or your designated places, consignees, what we call it, from there, how much quantity will be there? If they are being stored, they are being stored at primary healthcare system or the district headquarter or some centers where store is available. From there, how it will reach, how much quantity, who will transport, how it will be transported. If the spray team itself, it is taking little bit package and taking, whether are you having some plan to give for them transportation? Otherwise, they will put on the cycle. Then all your ECOP, what I have shown in that graph or 5 balloons, your environmental code of practices for safety of the hazards, if the from the cycle or the bicycle or the motorbikes, if it falls down and it spreads, then who will be held responsible? So you must keep some provision of transportation, safe handling. This is very, very important. This is the calculation norms which I just wanted. This is very, very important, not very complex. We have taken DDT as a base. And in country, I mean, DDT was used as 1 gram per square meter, whereas WHO dose was 2 gram per square meter. You can change it, but this formula will remain in standard. Take the base of DDT. If you take 1 gram per meter square DDT for 1 million population, that was based on lot of assumptions, calculations, sporadic checks, measurement of the area long back in 50s and 60s. So if the area wise you take 150 metric ton of DDT is required for 2 rounds. For malaria, I'm not talking where you are doing complete wall and ceiling. So five surfaces, full spraying you are doing, not for the visceral leishmaniasis, where you restrict up to 6 feet only. So for malaria, if you are using DDT, I mean, we have been using DDT. So 150 metric ton for 1 million population for 1 year for 2 rounds. So if 1 million population requires 150 metric ton for 2 rounds, how much quantity will be required for any insecticide which is being approved in your country with some dose? So you have to give number of rounds, you have to give number of dose, you have to give dose amount, and you have to give the annual figure is okay. So dose and rounds and the concentration of the formulation. For example, if you want to have, say, malathion 25%, malathion 25% is 2 gram per meter square, or you say 2000 milligram per meter square. So we have to see the unit is converted into 1. You cannot have 2 gram divided by 100 milligram or something like that, or 1000 milligram. No. So say, for example, if you take 150 metric ton DDT is required for 1 million population, you have DDT 50%, malathion is 25%. So more by less. You have malathion 3 rounds, where DDT you have 2 rounds. Again, more by less. So the basic principle is more by less. You have malathion 2 gram per meter square, that is 2000 milligram. You have 1 gram per meter square, so 1000 milligram. So if you solve this equation, it will come 900 metric ton per million population, which is the requirement for malathion for 1 year. This will help in making the logistic plan and converting the cost of it. It becomes very simple. The total population will require this norms. So your projected population is this. So this much quantity multiplied by the unit cost of the insecticide. It makes very simple for the making the financial plan of this particular insecticide requirement. You take another example. Deltamethrin synthetic pyrethroid, which many of the countries they have used or they are using still. Deltamethrin used to come in 2.5% formulation. Here DDT was 50% and malathion was 25%. But here the deltamethrin water dispersible powder for IRS, it used to come, it is coming rather, is 2.5% formulation WDP for IRS. Now both this DDT also require 2 rounds and deltamethrin also require 2 rounds. Deltamethrin dose for per square meter is 20 milligram, whereas DDT requirement is 1 gram or 1000 milligram. If in your country you have been using 2 grams, you can divide by 2000. So take one standard. We have taken our own example. If you solve this problem, 50 by the formulation by formulation, round by round, dose by dose, and the base value of 150 metric ton, you call it becomes 60 metric ton. This is an example of the calculation norms which will help all the people in converting your own requirement. Whether your requirement is 1 million, you can change. If you have requirement of not say 1 million, I mean it is 1 per 6, so 1000. So if you have 1000 population, you can just divide this 150 metric ton, convert into kg, and then divide by that per million. So you will get 1 per 60, and then you can have. So you will get for your particular area what is the population, what is the total requirement, and this all will remain same. So you will get in kgs. Have I made up to this place? It is clear. So then we will go for the next phase. What are other things, Leo? Dr. Leo?
Yeah, I see it's 6 minutes to, is this is a clear break from, it's a different section. So why don't we take 5-minute break over here, Pradeep?
Okay, fine.
5-minute break.
Let them think up to this place.
Okay, very
So,
good. All right, everyone. Enjoy a leg stretch, and we'll see you back in 5 minutes. Thank you so much. I'm not going to accede to the request immediately. I'm going to ask if we can postpone it to the question session. But there was a question here from, I think it's Dr. Mukhtar. Dear sir, can you please repeat or elaborate on the calculation of infections, the previous slide? So I see it was at 1:55 p.m. So I'm assuming it's not the infections, it was the dosage rate. That I'm assuming that was the calculation that he was a little unsure of. Maybe we can go Maybe we can go back to that during question and answer session if you can easily access it then, Pradeep. I don't want to interfere with your flow
Okay,
of
okay, okay,
presentation. So
okay.
please continue, and then we'll come back to that request during question and answer session. Thank you. Thank you, Pradeep.
Thank you, thank you. So, welcome back again. So, after doing all these calculations and understanding what are the topics we have to do, we have to also put certain points on the guidelines and SOPs preparation, because this also requires a lot of financial implications. It's not an easy job. You just tentatively, you can have, say, if you are developing new guidelines or manuals or SOPs for elimination setting or post-elimination setting, for the different transmission intensity settings, if you want to have any kind of literature, any kind of standard operating procedures, you require expert consultation. You require documents to be prepared, to be printed, to be circulated. So just an example, it is just a tentative, purely tentative, that if we keep for one development of new guidelines, 10,000 US dollars, depending on your own resources and availability. This will include the development of cost of the consultant, then meetings, then workshops, and then for some collection of some evidence-based documents, and then finally coming out with a draft. So that much will be one costing has to be kept. Just forget about 10,000 US dollar. You may work out according to your own requirement and resources. But this is just a tentative. I could have given X amount, but then it will become a little difficult to understand. If you are updating the old guidelines, you can reduce to the cost to the half of that. Whether you are doing for this guidelines or manuals or standard operating procedures. Many of the places, sometimes you know what happens, that guidelines are there, manuals are there, but standard operating procedure for each activity is not there. I have seen lot many other programs like AIDS and tuberculosis for drug distribution and for the case identification. There are some standard guidelines, but they don't exceed more than a page. So whether we do require, yes, we do require. We have been giving as an advisory to for these pre-supervisory teams, pre-teams, and all those things. So these are very important things which will require for the plan preparations. Then all those things are to be printed, and that printing also costs. Let's take for one book, one printing cost is say five US dollar or 10 US dollar. You can put anything. So how much, depending on how much copies you require. So these are the breakups of the activities for guidelines and SOP, that you conceive the idea, you do the brainstorming session, have the expert consultation, make the plan document after the consultation. So 3-4 meetings, or then collect this information, involve somebody to write, or somebody can draft, and then edit it, do the testings, and then give it for printing. When printed copy comes, it's dissemination, dispatch, everything it takes into account. So these are the 4-5 things which will be incorporated in that particular activity as a micro activity. If you are having meetings of the task force, you have made a task force committee, or I gave one example of the technical expert committee. It may be meeting once in a year, twice in a year, or quarterly for review of the program, for suggestions, or for mid-course corrections, or monthly meetings. You require some money for holding the meeting, because the people will come for the meeting. You require some agenda items to be circulated, some brief note to be circulated, calling them. It will require a lot many things. If you are inviting Zoom meeting or physical meeting, then you require to make them transportation cost, paradigm cost. So all those micro activities will be an inbuilt component for this meeting. That's why I told that you can have one Excel sheet for one activity. There may be 50 sheets, and then finally link with all those Excel sheets, the final outcome figure I'll come back to that. Now, yes, it starts. It's not much. I'll try to finish little early, but I have not given in Excel sheet. I've just made a copy and paste from somewhere. If you divide certain things, some examples from some different countries, if you have some activities to be framed like monitoring and evaluation, it starts. This is as per the framework for making the national strategic plan from the WHO side. So if you want to update the stratification, starting from that, that module I showed 6 or 7 categories, that situation analysis, it has 3-4 inbuilt component, then the tools, then the advocacy, then implementation, then monitoring, supervision. So if you want to have the situation analysis initial stages for first year, second year, third year, fourth year, and 5 year, how much total cost you will involve, and to come out this first year for this particular activity, annual update or update of general household, that is the population updating, and the local survey, household survey, or the training people on the GIS mapping or something, and then you are doing GIS mapping parallelly, it was going on in the morning. And then different district level or entomologist level, what will be your training. So governance and HR issues will come on the first. So the management plan has to be made for different year with different micro level working. So from there, it will come on this particular cost will be put it here. And there will be some norms you have to fix it. I'll just give one example, 1 or 2 example for the norms, like I gave it the norms for the insecticide calculation. Then the total for 5 years will become, then only your strategic plan for 5 years will be like this. Now, same way, if you want to enumerate the household for population, where you want to do LLI, because you make a logistic planning on the basis of estimates, but simultaneously your survey starts continued, that actual when the goods comes, when the logistic is supplied, how much distribution different places you will have to do. So simultaneously there is a enumeration of household population. You cannot make a plan that you will do first household survey for LIN, you will do household survey for IRS, then you will make a plan, then you will start implementation, then beyond 30 it will go. So simultaneous work will go. You have estimated some based on some criteria, tentative criteria, and simultaneously you are putting the household survey, going for LLIN distribution plan, so that it matches, or in between you can understand that there are some bridge, so you can always increase certain quantity or you can decrease certain quantity so that it is not on waste. Review of IRS, whether you want to have the phasing out of the population, the insecticide, or you want to reduce the population slowly. So these are the things. Annual procurement of insecticide, when you are planning spray equipments, machines, whatever you want to have, different rates, different numbers, multiply, put it in one line, and then total it, and then you bring it here. So these are all just tentative numbers we have kept from some pages we have taken. Training of spray squads, how much total number of spray squads you require, then what will be the total cost, unit cost, you multiply, and then finally you reach to one census. If you are doing in your own country currency, you work out in your country currency and then multiply with the exchange rate to convert into dollars, so that if you want to have some support from the donor agency in terms of dollars, you can always project in dollars. Spraying program at the district level, ad hoc spraying, focal spraying, how much buffer insecticide you have kept, how much total cost you have worked out for the cost of the insecticide, cost of the spray wages, for the number of squads required per million population, and then the transportation cost. So all together, clubbed together for one unit, what will be your total spray cost? You always keep the insecticide cost separately, so that if insecticide is changed, you have to add the insecticide replacement cost for with that, and then other the operational cost for the spray will be separate. So this will remain same, except in malathion, if you are using for 3 rounds, rest of the things will same is the case for the larviciding in urban areas, anti-larval operations you are keeping. So how much wages you are paying. So all those things will be in one sheet, it will come, and then it will be made a total of that. For this also capacity building has to be specific. So that is why capacity building, all those things will be come separately for each activity you can make. If somebody asks as a bureaucrat that what is the total training load you have made, then all these capacity building headings, you can just make a total and make it. But don't make your plan according to the people, what they want for their projection. You make a plan for your own technical requirement for different activity. Say, for example, if I have made a plan, if I have made a plan, sorry, if I have made a plan for 3 insecticides, synthetic pyrethroids, say deltamethrin, alpha cypermethrin, and lambda cypermethrin, the cost will be different. Like, okay, fine. I have made a spray wages, spray charts, and then somebody, and then is the advocacy plan. Simultaneously, I have made a training plan for the LLIM. I have made a training plan for the larval survey. Now, if somebody asks what is the total training cost on your total vector control, I can take those 3 rows of the training plan: training for the anti-larval squad, training for the fogging squad, training for the IRS squad, training for the, because their training will be different. LLIN distribution training and IRS training will be different. So those 4 rows total, I can just add and then I can put it. So one is clubbing the activity plan in totality and showing at one place. Then there is another way of clubbing. This is what this example is. There is another way of clubbing that you work it out that at national headquarters, what is your governance, programs, advisory, meetings, and dissemination of the technical guidelines. What is the total cost? Then at the state level, what is the total cost? So different states in different stratified area, their costing will be different. One state you may require 1 million bed net, another state you may require 20 million bed nets, another state you may require only limited quantity of bed nets. So different states you put it, different activities you put it, you just go on totaling and then make the plan, then club it. If somebody wants to LLIN total cost, you just total it LLIN. If somebody wants for IRS, you say somebody. So ultimately in the plan document, how we concise the things for making a showcase a total requirement. So ultimately it is like prism. Total cost for strategic planning, different components, different levels, then different activities, and then micro activities. So that the SOP will be on this, guidelines will be on this, and then your manual and your advisories will be from here, that we are sending this much quantity, please be alert on this. Like, for example, one example I have given that if you want to have involved the mapping or electronic transfer of the data, what do you require? You require computer, you require software, you require printer, you require server cost if you are doing something online. So what will be there? At national headquarters, how many you require? Say, 10 computers. At state level, you require 180. District level, you require 600 plus. CHC level, community health center, 100-bedded hospitals, you require around 5,000. Primary health centers, you require roughly around 25,000. So you just unit cost is this. So you just multiply with this. Software cost is this. Printer cost is this. You don't require printer at CSC and PSC because they have to only enter and send it. If you require, you can add it here. So the total will be this, and server cost is only one, or maybe you require state different and national headquarters different. So how many servers you require? Then you just total it and multiply the total cost for the computer. So the total cost comes like this. You can calculate in your Indian rupee or Pakistani currency or Bangladeshi currency or Nepali currency or Indonesian currency, and then convert into dollar if you are expecting something in dollars from the international donors. This is the way we put the plan document for compilation of the formulation of the plan. Then there are, again, we club it by the major activities. Major activities, I'll just give an example that what kind of expenditure we are actually going to incur. People will ask only 6 or 7 areas. I'm just giving one example: intervention cost, program cost, and governance cost. But basically, these are all clubbing of together of, we have got 8 thematic areas, 8 or 9 thematic areas. So one is governance issue, one is the total your epidemiological situation analysis, case management and treatment, then your entomology, entomology and vector control, then your ICBCC, social mobilization, operational research, and then there are some other countries, they have added 1 or 2 more cross-border collaboration. So these are all will be pooled together. How it will be pooled? What is the intervention cost? That will include all antilarval, LLIN, IRS, focal spraying, source reduction, intervention training, everything will come here. And then focal spraying, cross-border, prevention of re-establishment by vector control. So all those costs total will be total. See what I have tentatively shown here, why people may ask why it is 100 and why it is 200. Initially stages in the next 5-year plan, you may not start with full swing, but what you have planned, you may be able to start in the next swing. But then slowly it will start coming down as we expect that the cases will go down, zero indigenous transmission. So slowly it will reduce. So our intervention cost will reduce, maybe insecticide cost will reduce, labor cost will reduce. So all your contingent grant will reduce. Permanent cost will not going to reduce. Then program cost will increase. Program cost will stabilize at this level. Again, initial level, you may not be able to hire all the people at one go. You may not get entire technical skill development. So this will slowly increase from this to this, and then it may fluctuate. Some will join, some will go, some will not come, some will be transferred here and there. It will fluctuate. Those things you take the cognizance, and then what happens? Ultimately, it will stabilize. You have to ensure that this whatever you planned, it stabilizes within the next 2-3 years. Otherwise, there will be lot of challenges will come forward. Then governance issue. Governance issue is another major issue where total administrative setup, infrastructure, intersectoral collaborations, all those things will come, though it may not involve much cost because most of the places it will be inbuilt facilities will be available. So governance issue will be, I have just kept tentatively all together total, with a minor fluctuation it will have. You just total it for 5 years, but year wise total will come here, and this cost, the activity wise total will come here. So this is the way we try to make the plan formulation, and then sorry. This is the way we try to make the plan formulation and club the whole cost, and then we submit the project to the approving authority. Then the another process starts. Then there is lot of what you call it as a discussions on this with the kitty available with the government. Then there are a lot of changes are to be made in between. So final plan comes out, maybe you want to have technically say $500. It may come to, you may have to compromise 300. Then only the issue will come, what is non-negotiable, what is negotiable. So all these things will come in totality, and then only this thing will be finalized. I think I will stop here. My thing, I think 1 or 2 slides I could not save because today I was struggling hard. There was no internet initially. So Dr. Leo, I'll
Pradeep, are you saying that you I didn't have time to have a look at your full slide set because I only received it late. Are you saying that your presentation is completed?
let me just check it up. Let me just check it up. Yes. It's only one slide was missing. That was thanks, which is not yet saved in this. So this is all complete. And
Okay.
somebody
All right.
wants to ask some questions. Thank you.
Okay. My golly goodness. Yet another wonderful presentation, Dr. Pradeep. I think our audience will agree. This has been an exceptional course. I've experienced it as an exceptionally satisfying, enjoyable, highly instructive course. Dr. Pradeep, it reflects a lifetime of accumulating experience and knowledge from ground level all the way up to top senior management level. All the experience, the hands-on experience and understanding, right through to management insights and experience that you've brought together and shared here with us. I don't think there are many people that combination of knowledge, understanding, experience. And it's not just that, it's also the ability to convey that in a way that is interesting, crisp, clear. So you have that wonderful combination of the wisdom, the experience, the knowledge, and you have the ability to convey it in a very effective form. So I am so happy that we chose you as our trainer for this course, Dr. Pradeep, and we are definitely going to knock on your door again next year for a repeat of this course. I think everybody will agree this has been an exceptional experience. We've all learned a great deal. So,
Leo, I got two slides which I was missing. I got two slides, if you permit me.
by all means, please proceed.
So finally, these are the components of this national strategic plan. When you make the plan, you have to give country profile based on all those things which for the last 4 days we have been talking. It will give political context, demography, political commitment and context, what scenario is being run in your country, then socio-economic constant, national health systems, that is infrastructure, what is infrastructure of vector-borne disease control program, what is epidemiology of malaria, cross-border and imported malaria, indicator survey, if anything has been done after 2017 or 16, any indicator survey or external review has been done, review of performance of the previous strategic plan. This is very, very important. Usually people, they have forgotten. So they must have been done somewhere else, or people are changed, so they may not be able to know. SWOT analysis of the strength, weaknesses, opportunity, and threat. Because if this is not done, and we must understand our what is our strength, then collaborating partners is very, very important these days. Without them, so what ultimately it will come that when you came the second part of your strategic plan document after the background situation analysis, you have to specify what is your vision, goal, mission, guiding principles, what assumptions you have done basically in insecticide calculations or line calculation. I gave you one example, but what assumption for all other things, other activities you have taken, and what objective. The most important component is that every strategy should be backed up by its objective and what activity we are going to fulfill that objective. This is the basic format of our vector control plan or the whole strategic plan. Say, for example, if you are doing strengthening targeted and focused preventive malaria interventions, so whether how stratification has been done, what is the targeted area, establish rigorous quality assurance program. If whatever we are doing for quality assurance program for vector control plan, we must keep all the tools and processes what is involved, how we are going to fix up our quality assurance in that scenario, right from logistic purchase till the end of the use and disposal of disposal or the safe custody and the principle of first entry, first out wall, this business, so that the previous stock does not remain there and becomes outdated. Services of surveillance, whether it is an entomological surveillance and regular stock ad hoc arrangements or for ad hoc or focus investigation, or the evaluating and the prevention of reestablishment and outbreak investigation, we must have the objective, and for each objective we should have the strategy. This is the slide which I just made it. I do not know, it could not say, but I could retrieve. Effective collaboration, partnership is very, very important. What are the stakeholders? How we make them bring on our board. I always used to quote one thing: we will confuse them initially, then we will convince them, and then we will take their commitment, then only they will become our board. Otherwise, initially when you call them, this is your baby, malaria control, you please do it, we are all there, we will support you, but how? So these are the things how they will be involved in that. Program management and performance, we should always appreciate if somebody gives a comment that you are not doing well. Their way of talking may be different, but we should take the gist of the message what we are getting from them, because everybody cannot be thinking like me, everybody cannot be thinking like what I perceive. So their perception has to be appreciated, taken into account, and then look for how best we can improve in between in that. So these are different scenario. These are different scenario where we can do. Then advocacy intensification and operational research are very, very important. So these are the 7 basic thematic areas which must get a place in the total plan document. And then we should have, 8th strategy is monitoring and evaluation. And then the plan document should follow with different chapters like annexures and references and tables and diagrams. So we must keep the document very comprehensive, small, readable, so that it does not become a complete Bible or Gita or Quran or Ramayana. So it should be crisp, it should be readable, everybody should get a gist, with the prefix that it should be having, it must have one executive summary. That's all. Thank you very, very much, Dr. Leo.
Wonderful. There you put the cherry on top, concisely distilled. So thank you for that. That was really wonderful, summarizing everything up. So we still have question and answer session. This is also a highlight because people come up with very interesting questions, very pertinent questions. And you know, we learn a great deal in these Q&A sessions as well. Before we go there, so we're now on 97 participants, I see, and it's usual during question time, gradually we lose some people. So before we start with the Q&A session, I'd like to mention 2 things. First of all, just a reminder, for those of you that were able to participate during all 4 days, thank you sincerely for your interest and commitment. You will each be receiving a certificate of attendance within the next few days. I'm not quite sure how long it's going to take, but it'll be a few days. Certainly within the next week, you will each receive in your emails a certificate of attendance. Then also, you may recall when we first started on day 1, I asked your indulgence, your patience, please. We'd like to ask if you can fill in a very short questionnaire. It'll take 1 or maximum 2 minutes of your time, just to give us feedback so that we know next time what we can improve on, where we did fairly well, where we fell short. It helps us prepare for the next training session. So Dr. Aung, Popo, do you want to remind us where we find this questionnaire, please? I hope you can hear me. Popo or Wulan, any?
Yeah, so for the for the evaluation form. Could you please go to the Google form that our colleague Dr. Popol copy the link here in the chat box. I can copy you again here, and then it's not only short questionnaire, so please take your time to fill out the form. Thank you.
So it's the very last entry into the chat box. There's a URL there. If you wouldn't mind copying that and then pasting into Google, and the form, the evaluation form should pop up. And if you wouldn't mind, we'll give you 3 minutes. That should be ample time. Let me give you 4 minutes for those of you that may struggle to access the form. So I'm not going to distract you by keeping on talking about other things. I'm going to be silent for 4 minutes just to allow you some time to complete the form. And then we'll be back and resume question and answer session. Thank you so much. Please don't go away. Very interesting Q&A session coming up, I think.
Made and consumption, it was standardized. And that standard, if you take a factor, there is a standard norm that for 1 million population, you require 150 metric ton DDT, 50% of the powder. Yesterday, I was just giving one example that in 50s, there was a formula by Dr. A.P. Ray given 2 pounds in 3 gallons of water and 4 houses. Similarly, nowadays also there are formula. In India, we have been using 1 gram per meter square dose for DDT when you are spraying on the walls. So 1 meter square, the dose is 1 gram per meter. With that dose, the total consumption of the DDT, it came as, if you convert for the population, respective population for 1,000 population, and then convert into for 10,000 and for 10 lakhs, and then for, so 1 million population, it requires for 1 round, it requires 75 metric ton of DDT, 50%. If it is 75%, it will be something different. So 50% DDT, water dispersible powder or wettable powder, the standard norm is 150 metric ton population. We all have taken that as a basis for calculation of newcomer insecticides, new insecticide which are being brought in the market with the dose fixed for public health program. So if we take that, it is a simple quick calculation. It looks complicated because 4 parameters have been taken, 4 variables. But if you take one parameter and since and therefore formula, if you take, if the same dose is there, if suppose for example malathion, same formulation strength and same dose is there, the same quantity will be required. But if the dose is different, so we have to put, since 150 metric ton DDT is required for 1 milligram, the same concentration, same residual for malathion, same concentration for say 2 milligram, how much it will require. So it will be double. Same concentration by more by less of concept we have taken, that if you put 150 metric ton here, so for 25%, 50% DDT more, 25% malathion less. So 25% we have to divide 50 by 25. Similarly, for 3 rounds, in case of malathion, we require 3 rounds. So we will be requiring more. Here it is required 2 rounds only DDT, more by less. Malathion we require 2000 milligram, 2 gram per meter square. DDT we require 1 gram per meter square. So we have given 1000 milligram. So if we solve this formula, it comes 900 metric ton. If you take one denominator separately with the keeping all the things same, this formula will come same. You can, anybody can try with the since and therefore formula. Keep this also 1000, this also 3 or 2. So this will come exactly the same. That is how this formula has been derived.
Yeah,
If you,
sorry.
I think I have made it clear.
It is, at least for me, now it is crystal clear
Thank you.
that you're using DDT, where you went through all the effort to do the basic calculations of so many grams required per square meter, and you came up with 150 metric tons for 2 rounds per annum and so on. And you're using that as the reference amount,
Right.
and
Right.
in which you then calculate other insecticides relative by concentrations and
Very
so
right.
on. So,
Absolutely.
yeah. So for me, it's very clear now, and I'm sure if it's clear for me, it's very clear to everyone else, because I'm very slow at understanding these things.
No,
So,
no.
so I'm sure that we all understand it well now. Thank you for explaining that so clearly. I think you can take it off the screen now, Pradeep. That was a wonderful explanation. Thank you for revising that. So, Usha, you raised your hand. Please unmute yourself and proceed.
Good afternoon all. So this is not regarding, actually not regarding this session. Recently, WHO has approved IRST. Yeah.
Yesterday.
Yeah, may I ask if you can sit a little bit closer to the
audible?
microphone? At least I can't hear you very clearly.
Am I audible, sir?
It's a bit better. Yeah, try again. Usha, feel free to try again. Please go ahead.
Okay. Now,
It sounds better. Please proceed.
it's regarding WHO proposal recently has been approved for IRST. So now the question is outdoor.
Usha, I'm sorry, we're losing you. And at least for me,
I think I'll type in the chat.
yes, that's exactly what I was going to suggest. I'm sorry about that, Usha. If you wouldn't mind trying to summarize it in the chat box, I have no doubt Dr. Pradeep will try and respond. Okay, Abdu asked the question. I have a question, sir. Thank you, Wulan, thank you, Wulan, for summarizing these, extracting the questions. The use of DDT in vector control or pest management is prohibited in many countries, but why are entomologists still assessing the vector susceptibility against DDT? Dr. Pradeep?
Yes. This is again another $1 million question. But I'll tell you what happened. Basically, DDT is though under phasing out, but recently we have seen. I mean, that is my experience. What I just want to tell, because the governance issue at the WHO level, why they are producing, that is a different story. But chlorinated hydrocarbon, as a technical person, I can answer that DDT is representing chlorinated hydrocarbon as a base value again, and many of the African countries, they are still using DDT, and till 24 it is there. At least next only 3 years will be remaining for that. We do not know whether those people will be using beyond that. They will get some special permission sanction for African countries, 7 or 8 countries, or it will be completely phased out. As on date, it is till 24. So since it is in use, there is a need of doing this DDT susceptibility test. In India, partial plus 7 or 8 more countries in African regions. So I feel that as long as DDT in public health use is not completely banned, there is one compound for which we must do. Otherwise, this and resistance monitoring has also helped us in phasing out DDT.
Thank you, Pradeep. Yeah, I know in South Africa, well, DDT is actually banned worldwide, but there's exclusion in some countries for public health use, because as long as it's used indoors under very controlled conditions and so on. So DDT in general is banned, with the exception of specific public health applications in some requesting countries. So here's $1 million, a very difficult one. The question is from Dr. Mukhtar. Dr. Pradeep, can you elaborate the health and environmental hazards of DDT? There have been many books written on this topic. I mean, this is encyclopedia. You can give an answer as an encyclopedia, but can you try and summarize it for us, Pradeep?
See, DDT study has been done in fishes. DDT study has been in different ecological setting, in milk, in the animal milks. DDT, like all other insecticide, has been known as a carcinogenic. Mutagenicity has been proved. DDT has also lot of the accumulation. It has been classified into POPs. It is under phasing out. There is a full document on the Stockholm Convention, right from the inception of the Stockholm Convention till every vector control advisory group. And I presented laws, the triple COPs also I made a presentation that is the reason why DDT is phasing out. And I told you that when resistance study, there was questions that tube test of DDT or insecticide resistance monitoring emphasized that epidemiological impact was to be seen, and resource availability plus insecticide resistance plus epidemiological monitoring, it had an impact that on decision, it has impacted the decision that no, overnight DDT cannot be banned, so DDT should be allowed in public health program. But the hazards are well established, except one thing I have not come in my lifetime experience, or maybe some literature I have not read. I would like to know one example of any deaths because of DDT poisoning, because there is one document which I saw that even if you take the DDT what we are using in the wettable powder form, you can take 1 or 2, 3 spoons also, nothing is going to happen to your body. But DDT is known for, if you are doing some study on the laboratory and carcinogenic effect as per the chemical structure, yes, it causes the carcinogenic. But where are the carcinogenic effect proven? Only because of DDT use in public health. That is no publication I have seen. But yes, environmental hazard is because of its persistence as a chlorinated hydrocarbon. Health hazards, it is because threat is there, that it is since being in ecological chain completely, it is found nowhere it is seen that it is not missing anywhere. So the whole chain is with the DDT. That is why there is both the things, environmental hazard as well as health hazard, is a concern.
Thank you, Pradeep. There have been a series of publications from University of Pretoria in South Africa on the impact of sustained DDT use on urogenital, on the reproductive organs in both males and females. But I don't know the details of it, but there are some studies that show long-term impacts on populations, dramatic escalation in the occurrence of certain consequences. So here's a question here from Tuba Mukhtar. Sir, can you tell about the effectiveness of DDT against dengue vectors? Can you say something about that, Pradeep?
See, dengue vector since last 2 or 3 decades. I mean, when dengue was eliminated, it was not eliminated because of DDT in American regions and but when dengue outbreak has come now in the latest scenario, what is happening that DDT, the vectors of dengue, Aedes aegypti, and now Aedes albopictus, there is hardly a DDT spray in those areas. So you cannot have the assessment, the recent impact of DDT and the effectiveness on DDT on the dengue vectors. Because now only people are thinking about some IRS application in the dengue affected area against Aedes. But as on date, dengue was the main strategy was the larval control. So there was no anti-adult control for dengue was promulgated, except in outbreak situation, fogging, space spraying. And in space spraying, DDT was not used. So absolutely, I mean, there is no study I have come across the DDT impact on dengue vectors. But yes, some resistance study people are doing when they are trying to develop in the lab Aedes aegypti or Aedes albopictus. Some academic institutions they are doing. So that we have to wait for this complete outcome of that, not only tidbit papers.
Thank you, Pradeep. So Usha was trying to ask this question using audio, but we couldn't hear her properly. So she's, or he, has put it in the chat box. And I'm interpreting it as indoor residual spraying, which has been approved, of course, long time by WHO. Can we think of outdoor residual spraying, at least in hotspot areas, because outdoor transmission is becoming increasingly frequent and important? So I'm not sure if this is specific to DDT, or you're talking about outdoor residual spraying, targeted spraying, using other insecticides as well. But Pradeep, do you have something in general to say about the issue of outdoor residual spraying, cattle sheds or wherever?
See, the new guidelines of WHO. Yesterday also some documents, 3-4 pages documents were circulated in our WhatsApp groups. And I just wanted to talk to some people there. I could not mature. There's nothing new, actually. Outdoor spraying has been there in our old manuals in the period when malaria was rampant. Outdoor residual spraying spray treatment was there outside. Outside means you are not going to do spraying in the residual spray operation, which is on basically meant water dispersible powder, which this formulation water dispersible powder, not on the bushes, not on the vegetations, because the mode of action is entirely different. The mode of action of residual spray using the water dispersible powder is that the water dispersible powder will deposit, water will evaporate, and the insecticide will remain deposited on the walls. And when mosquito comes, it will feed on them. The outside mosquitoes, if they are feeding outside and they are resting outside, they may not rest. They may rest in somewhere in some deep wells or some crevices or some trees or some top. Every vegetation you are not going to spray, and there the insecticide deposit will not remain as the residual effect as you find it in there. But what outdoor residual spraying meant is for malaria purposes, that you are doing outside where there is some veranda or some outer space which is having one shade. It may not have 5 walls, 4 walls and ceiling, but it may have ceilings. People are using for sitting, people are using some like drawing room or village site. So that was meaning during that period, and all the structure which had 4 or 5 walls, they were being sprayed in addition to the regular rounds of spraying. Cattle sheds are also were there, mixed dwellings are also. So in different villages, different tribal communities. So I do not find anything new except the using the terminology IRST, indoor residual spray, treatments, and then now outdoor spray treatments. But outdoor transmission, now what we are facing, especially for the northeastern states, which is related with Balavasensis of the Baimai complex, they do not come inside the houses. They come outside, take the sleeping, the people who are sitting, sleeping outside, they take that, and then they go back to the jungle. Because they are bigger mosquitoes, but it may not take the full blood meal, or it may rest for some time there only. Now you see, so there this outdoor spraying will not be effective, especially with this formulation. Yes, we can do aerial fogging. We can think of aerial fogging also. We have been doing in 50s, 40s rather. So like Aedes was controlled with the aerial fogging only. So there are other ways, but this particular formulation, this is not clear in that WHO document, that ORST with this water dispersible powder outside, which are the surfaces which has to be defined. Thank you.
Leo, you're on mute.
Thank you, Ulan. So Giovanni asks, what is your opinion on the use of new generation insecticides for control? Can you speculate just for a minute, Dr. Pradeep, if you have any opinion on the newer generation of insecticides that are coming to the fore?
They are actually, Leo, they are thinking, if I am correct, they are thinking of neonicotinoids.
Yeah.
Or I could guess the question. I could guess the question because it is now, there are still toxicological effects. See, it does not mean WHO that earlier Hoopers or these people, they are in the pipeline. When final guidelines comes, I can show many papers where a lot of concern on the toxicity with the neonicotinoids are there. Again, I will tell you that it all depends on, technically we can go along with the WHO. When they are recommending something, they recommend some product based on some multi-country trials and with a range of the dose. In that range of the dose, if you test within your country ecosystem, ecological system or different scenario, and it fits in, and then toxicity study. And then yesterday, day before yesterday, when somebody was asking that we do health monitoring of the people. So the same compound may be good for African region, may not be good for Indian region, may not be good for Bangladesh region. So there are many ifs and buts before the product is taken. But yes, there are some new products are coming in, and we must wait and watch. Immediately, the decision cannot be taken for inclusion. But technically, yes, if WHO is recommending, it is based on the multi-country, multi-centric trials.
Pradeep, you missed your real vocation. I think you would have made a very good diplomat as well. Well responded. Good response there. So here's a question here from Tuba again. In the case of Japanese encephalitis, what would your recommendation be, first of all, for larval control? And then would you recommend fogging as use against adults?
Okay, no diplomatic answer. To the point, larval control, intermittent irrigation, drying once because mostly on paddy fields, the people are more concerned. So see that once in a week it is dried, and again the whole thing is given. The second question is fogging. We have been using malathion technical fogging, outdoor fogging, malathion technical, not water dispersible powder or wettable powder, only technical malathion fogging. Then the other compound has come as a synthetic pyrethroid, cyphenothrene, that is 5% cyphenothrene. It is as good for outdoor fogging, and this is also safer for indoor fogging also, space spray.
Okay, thank you. Very good response. Thank you for that, Pradeep. So here's a question. Sir, kindly share your thoughts on approaches for strategies to control dengue mosquitoes. And I expect you're going to suggest that integrated package.
Basically,
anyway,
yes.
let you respond, Pradeep. Yeah.
Dengue, we have to have we had actually in our country, we have given initially octalog, we call it as an 8.8 strategy. Starts because vector control, if the people are asking about the vector control, we have to have the larval control, source reduction, first identification, source reduction under integrated system. We used to employ domestic breeding checkers, DBC, domestic breeding checkers. Their job is, they are not well-trained entomologists, but their job is only to see, we will give the short training. They will see that they should be able to identify the larva breeding in this. And what is the typical habit of the dengue larva? They will go against the sunlight. They will be accumulated somewhere in one shady place within the tank or some corner, and with the wriggling movement. So they will be able to tell, yes, dengue positivity. Once they find it positivity, we will convert into the different indexes, the larval indices or Biroto index or container index. Depending on those indices, we will go and try to see that whether the sources are removed, or if you can use 1 ppm concentration Temifos. In the coolers, as I showed you yesterday, there were some coolers and all these things, desert coolers. They used to have Temifos granules. So the larvicidal application, the fresh water, the potable waters rather, not drinking water. Then you have the IGR compounds, pyriproxyfen granules also, it is there. You have to use the Temifos granules for the coolers, other places. You can use all devices to educate the people. Once in a week, dry day. Dry day for keeping the water away. Water dried, not only dried, you remove the water, dry it and scrub it. Scrubbing is very important in case of dengue prevention, because otherwise the eggs will remain sticking there only, and then again they will be there. So the best portion is that remove the water, change the water, dry it, and keep the lid covered always. There is a belief that God is giving some sunlight, so the water is getting purified. So there are different myths and belief, we have to remove it. Thank you.
Thank you, Pradeep. Also, use of predatory fish species, small fish species, guppy fish, and so on, in water storage jars or other water tanks, etc. These fish are extremely effective in keeping those containers free of mosquito larvae.
Very right.
And also waste management, just trying to reduce the number of empty tins, bottles, cans, coconut husks, and so on, lying around the household, because dengue vectors, as everyone knows,
small things,
can breed in very small quantities of water. So you need that integrated approach. So I'm not sure that I see any other questions. Is there anyone that wants to raise a hand and make a comment, share some experience, or ask a question? Just a request, please, if you don't mind, those of you that may not have had opportunity to fill in the evaluation form, I'd be very grateful if you could just find the URL in the chat box.
Raise hand.
Copy that URL into Google and just complete that. Shouldn't take you more than 2 minutes maximum. It really helps us to get that feedback from you. So, Anju, I'm hoping this is not a legacy hand, that you have a fresh question. Do you want to try again?
Yes, sir. Good afternoon, sir.
That sounds better. Try tell us in your voice.
Just I need a clarification, sir. So actually DDT is almost phasing out from India also. So in this scenario also, in some places of our country, we are using DDT, and some other places alpha-cypermethrin and delta-methrin and lambda-cyhalothrin for IRS. So my concern is that in a single state, we are using different types of insecticides for IRS. for example, alpha cypermethrin and DDT. So in same districts also, there if there are different blocks, in one block we are using DDT and other blocks we are using alpha cypermethrin. So is it beneficial, or what is the impact on the development of resistance?
Pradeep?
This is technically wrong, but this is managerial issue, operational issue, that there has been some DDT lying somewhere. Either you allow to expire or transport. Sometimes smaller quantity transportation will be very costly, and the people who do not need it, if you have demanded, you have not been able to use it for certain reasons. First spray was not there, second spray was not there, so you are answerable for all those things. So you try to finish all those things. So these are all basically managerial and operational issue, because we always technically say that spraying should be in terms of time, space, and synchronized products also, whether you talk of districts or you talk of, if yes, in a bigger district, in a different ecological zones, like I gave one day example of one district, Visakhapatnam, it has got 3 different ecological zones. If you have been using one zone, entirely different paradigm, and you are using DDT, continue on using, that is justified. But in the same districts, different blocks, just to patch up the things, and you want to finish off those insecticide because you have got little bit synthetic pyrethroid, you had some balance amount of DDT. Anyway, you will get the insecticidal impact if it is done properly. But technically, you should have planned, and that is what the whole 4 days exercise, that how to make a good plan.
Yeah, okay, thank
Good.
you, sir. One more.
Okay,
One more
please
thing.
go ahead, Andrew.
So according to WHO, it is the norm is like that. We only one intervention we have to use in one area. Like that, if we are using LLIN, there is no need to use IRS like that. So if you are doing both, no,
Yes,
both we
please
can
go ahead.
use.
Please go ahead.
So if you are using the both things, that LLIN and IRS in the same area with the same insecticides, so that will lead to the development of resistance again.
Yes, you are partially true, Dr. Anju. It is a very, very, very intelligent question. And I think I have been answering such questions repeatedly in this country. But read the full sentence. WHO says, if you are doing one intervention, you should not do, provided you achieve the universal coverage. If you have not achieved universal coverage with LLIN, you should not use the same compound of insecticide. I mean, if you have achieved the universal coverage, you should not use the same compound. But what is the option? The option, you have got chlorinated hydrocarbon, only DDT. Malathion cannot be used. DDT is under phasing out. You have only synthetic pyrethroid. This is not only challenge for your experience, this is challenge globally, that those people who are purchasing from their own government fund, forget about the donor-driven funding, donor-driven supplies. If you are purchasing from your own funding, domestic funding, you have only 2 options: synthetic pyrethroid impregnated LLIN, synthetic pyrethroid for spraying. Maybe you can just change the class. Then another point WHO says for resistance precipitation, that try to rotate the insecticide. How fast? Insecticide is manufactured with 2 years shelf life. You want to change it within 1 year. The 3 months it takes for procurement, and next another 1 and say about 1 year and plus 9 months it takes for you to spray. By the time it reaches to there are hardly only 1 year is left. So how can you rotate? How can you put the demand? How can the production people will do the production? So there are some operational challenges in that. And the first is that we have not been able to certify. Yes, the concern is genuine, that more insecticide pressure, faster the precipitation of resistance.
Thank you, Pradeep. So, Dr. Mukhtar, I see your hand is up, but in fairness, Daniel Halu was before you, so I'm going to ask his question first. Does anyone, Dr. Pradeep, let's start with you. Do you have any idea, do you have any knowledge about how effective larval control is using Toxorhynchites larvae?
Toxorhynchitis is a bigger mosquito, and there is autophagy also is there in Toxorhynchitis.
Yeah.
Toxorhynchitis also eats other larvae also. I have seen Toxorhynchitis. But we have never assessed exclusive larval susceptibility or larval effective anti-larval effectiveness against the toxorynchitis because it was not directly related with our disease pattern.
Dr. Mukhtar?
Yes, are you hearing me?
Yes, very clearly. Please
Yes. Sorry,
proceed.
since morning I have very bad internet connectivity. That's why I'm a bit silent today. Yes, there was a question about this is just my comments about the combination of intervention, and she rightly mentioned, and Dr. Pradeep very rightly explained this. And one point which I want to add about the combination of intervention, why we are not recommending or not encouraging, is the cost effectiveness. Because when you use the both combination, as Dr. Pradeep rightly mentioned, that each intervention when shows the give the 100% coverage, there's no need of use of other, because it will not be cost effective. So WHO mainly show the concern, even the national programs, that the when you make the combination of intervention, cost effectiveness should be given the top priority for the selection of the both intervention. Over.
Thank you. Thank you very much.
Thank you for that confirmation, Dr. Reinforcing the message. Thank you, Dr. Mukhtar. So Giovanni asks here, or she suggests, would you like to explain India's strategy for controlling urban malaria, Anopheles stevens eye? Of course, this is a very, very hot topic because of the spillover, the invasion by Anopheles stevens eye, very good urban vector into the Horn of Africa. And just within the last 2 weeks, we learned that it has now been recorded in Nigeria, which is completely the opposite side of Africa. So, you know, it's highly likely that it's now occurring throughout the entire range of states from the Horn of Africa, Ethiopia, all the way across through Africa, all the way to Nigeria. So, I mean, we can talk about this for a very long time, the overlaps with
Give me a second.
Aedes.
Give me a second.
Okay. I'm not sure if Dr. Pradeep is going to fetch his 10 encyclopedias on Anopheles stevens eye there. But this is a big issue that is now increasingly becoming urgent because it can add a whole new dimension to malaria threat in Africa, where malaria in Africa has traditionally been a rural problem. And now, of course, you know, on top of the challenges being faced with just keeping the lid on rural malaria in Africa, now you're facing the challenge of urban malaria, which is a whole new paradigm and threat. So,
Yeah, Leo,
Dr.
Okay.
Dr.
Pradeep?
Ghosh, yeah.
Okay. Before Ghosh you come into, I'll try to explain it.
Yeah.
We in the program, because Dr. Ghosh has been associated with research and giving some kind of solution with the larval control fishes. But as a whole in the program, we have a strategy since 1981 for urban malaria. And the first booklet which we wrote, if everybody can see this book.
Yes, excellent.
This is a special operational manual for urban malaria scheme. Then we also promoted this book also. This is a WHO book. This is health bulletin number, I think 12, health bulletin number 32. This is malaria incidental to engineering constructions.
Thank you for making us aware of that, Pradeep. Yeah.
This is very important book. We have been taking the classes based on these two books. This has been reference books for malaria. One was written by me and one was written in WHO by I.M. Puri, whose key we have been following. See what happened. I'll just take 2 minutes to explain urban malaria program in India. Urban malaria started after rural malaria failure and then resurgence and then modified plan of operation in 77. and then National Filaria Control Program, which was being run separately into National Center for Disease Control since 55, based on only larval anti-larval operations and parasite treatments, detection come treatment. It was brought for operational purposes to the program because the program was governing the district and the state authorities for implementation purposes. Urban malaria scheme, which was instituted for in a different phased manner, different plan period, and finally it landed with 131 towns to be covered. In fact, 186 towns were sanctioned initially, but the basic challenge was that state has to bear the cost of the total infrastructure. So because of that, 131 towns only were implementing urban malaria scheme, plus NFCP, that is National Filaria Control Program, which was being run in the towns only with the larvicidal operation. So they were using Fenthion for polluted water, which is now banned. They are using biolarvicide. Urban malaria people, they were using Temifos, which was the in potable waters. What they made, they amalgamated both these things as they made an urban VBD scheme, and these 132 and 206, roughly around 400, 300 plus towns, they became the urban VBD scheme, and there is an urban health mission. So all the urban areas where you cannot do the rural, like rural area is spraying, you have to do source reduction, advocacy, intersectoral collaboration, anti-larval operations. Anti-larval operation, there is a full-fledged scheme to make a beat program. Beat program word has come from police beat. So on weekly basis, they will go to the report to the depot. They will take their own larvae pump and everything larvicide. They will go. They have the full roadmap marked. Implementation, yes, there are many challenges because many of the people, they have been shifted and they have been transferred to sanitation department. Because integration, when we talking, it looks very great, but implementation within integration within integration is a very, very complicated subject. So who is your father? Nobody knows. Whether it is an urban malaria health officer or urban health officer or corporation commissioner, so nobody knows. In between, there is the larvicide, which was there since beginning in the program. It was emphasized by the then director, late Dr. VP Sharma, and then lot of scientists involved in National Institute of Malaria Research Center. They came out with so many documentary evidence they produced in different area, especially like Dr. Ghosh is there. He has already explained, he has taken one class in APMEN, yes, that on the larvivorous fishes, different larvivorous fishes, their capacity, larvivorous capacity, there are 10 at least identified with indigenous species, starting from Gambusia guppy, plus Aplokyla, Danio, Rasbora, and there are so many. They have been used in the program, and they have demonstrated that in the mines area, where they just dig the tank and then they leave the water to dry and then come out the mosquito breeding. Then plus there are some sericulture area where you cannot use any insecticide, even the larvicide you cannot use. So there, yes, the step well is very, very common, where initially there was a lot of problem of guinea worm. So yes, those places they have used, once the guinea worm was eradicated, then they used this, and it was shown remarkable success. So there are strategies, and because in a very short time it cannot be explained in detail, but yes, Stephensi breeding is increasing. And when we started our career, our guru, late Dr. Kalra sir, he told it is very, very difficult for Stephensi to establish, but once it establishes its existence, it is hard not to crack. And that is what after 35 years I am saying the whole world is trying to face the problem. I am talking on that Stephensi invasion mosquito. We are going to have one separate symposium in next coming American Society of Tropical Medicine. Along with me, there are 3-4 more speakers, a separate symposium on Stephensi invading mosquitoes and how to control in Africa. Thank you.
Thank you for that, Pradeep. As always, excellent response. Dr. Ghosh, do you want to add to that?
Yes. Actually, just to add with Pradeep, Stephensi, I was just discussing in one point that from this Amravati, which is the district where Liston 1901 described, there is a village called Achalapur. Now it is called Ilachipur. That story goes on. Now there it has gone to, now you are telling Nigeria. Okay. Now the thing is that recent studies, one of my group, that they are trying to find out how this population genetics and the population structures of invasiveness occurs. So recent publication we have found there are strong heterogeneity among different populations, and that might be one of the reasons for expansion. What is we find in Indian population is might be different in the population in other areas. So that invasive species like Aedes mosquitoes depends on how genetically they are structuring and adapting quickly on the local situations. But Pradeep is telling, what Karla Sahab, my mentor also, he helped me a lot in designing live fish. When I came in Bangalore 94, Dr. VP Sharma said, I'm sending Dr. Kalra, you take his help. One thing he told me, that the epidemiology where you are finding in the sericulture area is different. Leo, you don't believe it, in the month of July, now it's still raining here in Bangalore, and now everywhere. He said that is the peak season. That means there are certain focus point of the breeding of the mosquito going on, and that we found the whales. And we targeted the whales with the fish. See, that analysis is very, very important. So now I was, tracking in Mumbai. I was asking the people that those who are in the control program. They say, sir, from July to December, we engage extra people for vector control program for larval source, this thing. I said, this is wrong. You just reverse it. You have to, from January to June, you have to work more, where the bunkers this Stephensia is hiding. And you have to strike then. When rain comes, they have come out of the bunkers and they're spreading everywhere. So some strategic action plan must be taken into force, and then you have to plan the design. And what Pradeep is telling, very correct. Bombay has given very, very high, work pattern. Very nice. 7 o'clock to 2 o'clock. They work very systematically. But even though dengue and malaria, Mumbai is the highest among all the urban cities. Now, good news is that Mangalore cases are going down. I was even, when Pradeep also joined in the last workshop by Aklama, I was talking to the entomologist. She said, I want some Stephensia for some other reasons. But she said, sir, there is no Stephensia, you are getting the number you are wanting. So initially when I joined in IMR, and then 1996, I was following in Mangalore city. Anytime this time season of the time, you'll go, any number of larvae or mosquitoes used to get. Now she's telling, because that vector control team has activated, they are doing building constructions, they have taken care. So certain activities now going on, that kind of activities has to be done. And what Pradeep told, that Dr. VP Sharma, he made 7 action plan for Chennai, 7-point action for Chennai for Anopheles Stephensia. And Leo, you can remember in my talk, I have given that kind of thing, how this can be done. I think they can even see my talk on Stephensia on, I think 30th, I think October, I think I remember. So that they can go through, and it is in the your AppMen website. This answer you will get.
Some more questions are coming up. Very important questions are coming up, Leo.
Yeah.
Yes, absolutely fascinating. These question and answer sessions are really valuable because people come up with interesting questions. So I really enjoy these question and answer sessions. And Dr. Ghosh, I mean, you made a very pertinent, relevant observation, the dry season interventions. In Africa, Anopheles arabiensis has also prefers breeding in smallish pools, in small pools, not Aedes type pools, but say 1 or 2 meters, and even footprint pools. Even Aedes type, but more in soil, not in empty tins and so on. So the time to target arabiensis, for example, is when there are relatively few breeding sites.
Exactly.
And that is in the dry season.
Exactly.
If you wait for the wet season, you've missed the boat. Too little,
Yes.
too late. Yeah.
Exactly.
So
Exactly.
yeah. So very interesting. So here's another. We can't carry on indefinitely, unfortunately.
There are 3-4 important questions have come up now.
I know.
Yes.
I'm
I
not
have
sure.
read it. I have read it. Can I go quickly to answer
Yeah,
them?
please go ahead. Please go ahead.
Okay, the first is from Surajita Banerjee. Can we think of window or door curtain impregnated along with LLIN to control vector from coming inside the houses? Yes, you can do, but don't look at the program to support for this. These are all the technical issues. Technically, yes, it is recommended. If you can use LLIN as the impregnated insecticide mosquito net, you can also impregnate your door curtain. Door curtain has already been advocated. But yes, program support by supply cost and logistics management is entirely a different issue, because then it has to be processed in a different way. So that is not yet come into the program, because then there are so many manufacturers' willingness, production, design, registration for that particular product by the Central Insecticide Board. So all those things will come up. But yes, if you have a plain net and you have the insecticide, it is available in the sachet, is available in the market, you can use it. The second question is from Tuba again. What are your views in the natural repellent plant oil and herbs and vector control, particularly in the pre-breeding seasons? See, natural repellent as which is available in the market, in the retail market, people are using because they are registered under Drugs and Cosmetic Act. If I talk an Indian scenario, it is not registered for public health program purposes, because registration has two things. You want to sell it as and when you produce in the retail market, you have to apply for a Drugs and Cosmetic Act. If they have some insecticidal component, it will be regulated through a different channel. So that institutional mechanism is different. So when you talk technically, yes, you can use your natural repellents available. I also do use. I have put my mosquito, this vaporizing coil is on throughout the day, throughout the night. But we don't expect, look at the program to supply off and on like DDT or LLIN or Tamifos or something like that. So yes, technically, yes, you can use it. Peak breeding season, no, whenever you feel mosquito nuisance, any mosquito nuisance, you have to use it. There is no question of that. The second one is, the answer is, the second question is from Mahani Yusuf. Can we use different control methods in one locality according to the cooperation of the residents? For example, there are 20 houses refused to be sprayed. We gave them LLIN, and the rest of the residents who do not sleep in LLIN, we will run for IRS, ORS in their houses. See, these are all depending on the situation analysis. IRS is recommended for regular rounds where you should not miss. You have to convince them. There is no question of refusal in that. Refusal will be taken in that. LLIN is supplied with a different philosophy. But if somebody is refusing, you can't, we are not working like a police force. We are only health professionals. If they are not using, we can't have. It's a compromise formula. But technically, no. If you are using one strategy, you should try to have this whole scenario in the things. The another question was, where it is gone. The another question was from, I think, Usha. It has gone somewhere. Yes, in elimination setting, when the malaria cases and vector intervention are restricted to few areas, and if the percentage coverage of intervention is suboptimal, that is what is the challenge. Percentage coverage of intervention should not be suboptimal. That is what we have been talking since 3-4 days. Shall we think of combining the methods and of course complying with the technical issues? In this scenario, cost effective will be involved. When you make a plan, Usha, when you make a plan, we should not think on these lines. Because when you make a plan, you cannot say that if this situation, hypothetical situation will arise, we will go by this option. No, you say only if the financial resources are, why the people will not accept? Because financial resources, convincing people from the state, from the district, they will not move quickly to that area. That is what the reactive response in that area should be optimal. That is what our surveillance system should be so strong that on the first notice itself, our person is there to convince them. If people are convinced, it will be very difficult. Yes, there may be a situation where 1 or 2% people will not cooperate with that. So there are combination. You are absolutely right. Those combinations can be tried, but you don't give an option that if you want to do a spray, don't want to do, okay, you take the LLIN. Don't want to do both, you will do the LLIN. No, don't give this option. That's all. The next is Urvi Haryani.
I
Good
think we
afternoon.
must make this the last question.
There are lots of natural larvicide are showing good effect as a larvicide. So why use Temifos, BTI, etc.? Very good, very important question. Plant products have not yet been registered for the public health program. There are very, very important, very significant reason. Let me tell you my experience. Plant products, they come with certain what you call it as their chemical constituents, but they don't want to leak the analyze what is the individual chemical component because of which this shows the larvicidal capacity. So unless the compound, once it is killing the insect, as long as they claim that it is killing the insect, they must come out with that particular chemical within the whole gamete of the extract, that which particular compound. There have been many people who have been approaching when I was in chair, but this has not been, because once you ask this question is not by us, this question is asked by the regulatory authority, Central Insecticide Board. The extract of the plant leaf or extract of the plant stem or extract of the seeds, what exactly it contains. Like when we extract Chrysanthemum sanrifolium seeds, we don't say the extract works. We say, okay, this is the pyrethrum extract 2%, which works against the larvicide. So that is the basic reason why these things have not been registered under the Central Insecticide Board. Doing research, giving the patent formulation is entirely a different story. But coming through infrastructure, institutional mechanism for the public health program, they have to follow certain norms of the country. Thank you.
So I think we have to draw the line now. It's such an interesting subject with such, the level of people involved here. Everybody would like to understand more of the details in surveillance and control and the practical field realities. We could go on for several days more, and I would enjoy it, but we don't have the time. So from all of us, Pradeep, job well done. Congratulations.
Thank you.
And sincere thank you to you for a really fascinating 4 afternoons of discussions and allowing us some access to that brimful brain of yours. Sincere thank you for that. To all our participants, you've been a wonderful audience, wonderful participants, committed to this course. You've asked wonderful questions, and it's been a wonderful ride together, a journey of discovery together. So to all of you, sincere thank you for your participation. To the backroom team, Dr. Pon, Dr. Popo, Wulan, our gratitude to you for keeping us all on track and making sure that the technology is available. So I wish I could continue interacting with you. I'm reluctant to let you go, but I have to. So to all of you.
I'm always available for you, don't worry.
Thank you very much. Keep well. All the best. Until the next course or webinar. See you next time. Bye-bye, everyone.
Thank you. Bye, everybody. Thank you a lot. Thanks.
Thanks, sir. Thank you very much.
Thank you, sir. Thank you.